Welcome to the Alternatives for Children training on Universal Precautions, Body Substance Isolation or BSI Guidelines, and Healthcare Plan. At Alternatives for Children, the health and safety of our students, families, and staff is as important as the educational and therapeutic programs we provide. One way we ensure health and safety is to create a healthcare plan for each site. This training will review some of our healthcare plan details. It is the responsibility of each staff member to know the healthcare plan for their site. Health and safety procedures. Annual and periodic training will be available to staff to ensure their understanding of the health and safety procedures. Training will also occur when there are changes made to any of the healthcare plans. What is a healthcare plan? A healthcare plan promotes the health and safety of children. The healthcare plan must be on site at all times and followed by all staff. The healthcare plan must be approved by the program's healthcare consultant. Here at Alternatives for Children, our healthcare consultants are the school nurses at each site. The daycare plan has to be completed and submitted to the New York State OCFS licensor, and it has to be renewed every 2 years. The healthcare plan must describe the following: the guideline for child health and immunizations, the criteria for exclusion for children who are ill, children with special healthcare needs, daily health checks. The healthcare plan must address how those are conducted and documented, staff health policies, infection control procedures, and emergency procedures. Now describes decisions that are made on administration of medication. So not only what medications will be administered, but also who can administer them. Our healthcare plan includes policies on infection control, gloving, hand washing, diapering, cleaning, sanitizing, and disinfecting, and there is a confidentiality statement as well. The healthcare plan can be found at each Alternatives for Children location. One copy is always kept in a binder in the nurse's office, and one copy is kept in the administration office. You can also find a copy of our healthcare plan in our AFC policy and procedure drive. And it's important that all employees understand and review the healthcare plan. So the school nurse at each site is designated as our healthcare consultant. So what are their responsibilities? It's their responsibility to make sure that we are administering medication correctly, we're documenting medication correctly, and ensuring that policies and procedures are safe and appropriate for the care of children in the program. One example of this is removing students from class who are too ill to participate, contacting families for clearance. In addition to our school nurses, there are MAT-trained personnel at each school site. These employees can administer medication by following the healthcare plan and each student's individual healthcare plan. So MAT stands for Medication Administrative Training. These are employees that have attended additional training in order to be able to administer medication to students. At each site, some of our students also have an individualized healthcare plan. So children with special healthcare needs means children who have chronic physical, developmental, behavioral, or emotional conditions expected to last 12 months or more, and who require health and related services of a type or amount beyond that required by children generally. So this includes students who are prescribed an EpiPen. This is also for students who must take medication while in school. So in addition to our healthcare plan, some of our students have individualized healthcare plans. The daily health check occurs when the child first arrives at our program. It's important that you get down at the child's eye level and just check for several things. The child's behavior, is it typical or atypical? The child's appearance. So when we're looking at the child's appearance, we want to make sure that we're doing that with their clothes on. There's no need to remove clothing. You do want to remove any outerwear, coats, hats, gloves. But besides that, anything else you're going to look at for child's appearance is going to be while they're dressed. Checking with the parent, how did the child sleep, eat, their behavior prior to coming to school. Oftentimes our parents will reach out to us, they will write a note, they'll contact the teacher or the school nurse to give them any information if there were any issues with the child sleeping, eating, or their behavior. If you don't have that information and you have some concerns, you can reach out to the school nurse who can contact the family, or you can write the parent a letter, a note to go home that maybe they can answer the next day if it isn't anything that seems to be too severe. But again, you're going to want to check with your school nurse, see if they have any information, if the parent shared anything with them, and if not, they can reach out to the families. Of course, you're looking for any evidence of illness or injury, any indicators of suspected child abuse or maltreatment. Here's a copy of our name to face log, and this indicates where the daily health check is completed each day. If you need more information on how to complete the daily health check or the name to face log, you can find that in the AFC training folder on public in training modules name to face procedure. Key criteria for exclusion of children who are ill. So these are some of the things that the school staff and the nursing will look at to determine if a child needs to be removed from the program activities. So the first is the child is too ill to participate in program activities. If a child has a runny nose, maybe they have allergies, they have a small cold, they could still participate in most of the program activities. We're looking for health reasons that would disable a child from being able to participate in program activities. The illness results in a need for care that is greater than the staff can provide without compromising the health and safety of other children. So we're always considering the health and safety of all of our students. Any acute change in behavior, persistent crying, irritability, lethargy. Again, the key word here is persistent. So you're looking for students that are persistently irritable. They appear lethargic throughout most of the morning. They're not eating. They were presented with snack and lunch, and they're not eating at all. Those are persistent changes in behavior that we certainly want to reach out to the school nurse and discuss. Staff health policies. We're keeping our students and our staff healthy, so we have regulations on staff health policies. And some of these happen before you're even hired. We want evidence that you've had MMR, that you've had a PPD, a tuberculosis test, a general physical exam we want, and those are annual requirements. So these requirements are often discussed with new employees when they're first hired by one of our HR personnel. And if it's something that needs to be done annually, our HR department will reach out to the employee and let them know that it's time for their physical or it's time for their PPD. Infection control. Hand washing is one way we can really minimize the spread of infection. So we are going to be washing our hands very often at the beginning of the day, before we give any medications, when they're dirty, before and after food handling or eating, any contact with bodily secretions or fluids. So that's if you're helping a student wipe their nose and you're not wearing gloves, you're going to want to make sure you wash your hands after that. And always after coming in from outdoors. We have to remember that gloves are not a substitute for hand washing. So you really want to make sure that you're washing your hands as frequently as possible during the day. So in addition to the staff washing their hands very often, we're going to ensure that children thoroughly wash their hands many times during the day. So when they first come in the morning, they're going to wash their hands. When they're dirty, after they've done toileting, before and after food handling, the students are going to wash their hands. After coming in from outside play, they're going to wash their hands. And using the sand or water tables, even though they're playing in water, that water is very stagnant. It's been exposed to hands, maybe whatever items you have in the water bin. They're going to wash their hands again after playing in the water table. It is important that all staff and students wash their hands following the outlined hand washing procedure. It's important to remember to include between the fingers, under and around fingernails, back of hands, and scrub any jewelry that the staff might be wearing when washing your hands. We want to use the paper towel to turn off the faucet and also to open the bathroom door. And then, of course, make sure that we discard the paper towel appropriately.
Okay, so we're going to wash our hands. First, what we should do is I usually turn on the hot first and then the cold, but whichever you prefer. Put on some soap on your hands, rub them together. You should do it for 20 seconds. You can sing Happy Birthday twice, or whichever little songs that we use with our friends are also good for us to do as well. Just be cognizant to get the bottom of your hands, the tips of your fingernails, underneath your fingernails, around your thumb. If you have rings on, I like to slide mine up and get underneath my ring. The wrist. You should always rinse from the wrist down. Once you're done washing your hands, you should still leave the water running. Grab a paper towel to dry them. Once they are dried to your satisfaction, you can grab another paper towel, turn off your water, and dispose.
All students will be diapered on the changing table in the diapering area, so the exception to the rule will be non-ambulatory children with special needs and children weighing more than 40 pounds. If you have either one of these concerns with your students, please make sure you reach out to your supervisor. Safety precautions related to blood. So disposable gloves must be immediately available and worn whenever there is a possibility for contact with blood or blood-contaminated body fluids. The easiest way to do this is to always make sure that you have a pair of disposable gloves with you. You can keep them in your pocket. You can make sure that they are in the red backpack, but always have a set of gloves with you just in case you may need them if you suddenly become in contact with blood or contaminated body fluids. Again, as we said before, we want to remind everybody that gloving is not in replace of hand washing. So when you take these gloves off, you're going to want to make sure you still wash your hands following the procedures we just spoke about. In an emergency, a child's well-being takes priority. A bleeding child will not be denied care even if gloves are not immediately available. It is to your benefit to always make sure you have a pair of gloves with you ready to be put on. In the case of medical emergencies, the most important thing to remember is to remain calm. You want to contact the nurse and administration as needed. Reassure the child and other children. If the area is unsafe, move to a safe location. follow first aid and or CPR protocols, call for emergency services. It is typically our nurses or administrators that would call for emergency services. Follow instructions given. We want to make sure we send the emergency contact information and permission to obtain emergency care with the child when they're transported, and we have to notify the parent of the emergency as soon as possible. If the emergency creates an opportunity where the student and the rest of the class must be separated, it is very important that the teachers remain with the class. If possible, send the teacher assistant or a one-to-one aide. You can leave them with the child that needs help, but it's the teacher's role to stay with the class, stay with the large group of students at all times. In order to administer over-the-counter topical ointments, lotions, creams, and sprays, we must have signed parent consent form. So some of our sites in the summertime apply sunscreen. In order to even apply the sunscreen, we have to have a signed parent consent form as well as the sunscreen itself. The item must be kept in the original container, labeled with the child's first and last name. It must be kept in a clean area that is not accessible to children, and leftover expired lotions, ointments, and sprays will be given back to the child's parents. Teachers and teacher assistants can apply over-the-counter topical ointments, lotions, creams, and sprays, such as sunscreen, diaper rash medication, as long as we have the parent consent and we have the item that is marked with the child's name. That is not a service that only the nurse has to do. Over-the-counter topical ointments, lotions, creams, and sprays can be put on by the teacher or the teacher assistant. This page reviews the proper procedures for putting on and taking off gloves. If you are unsure of the proper gloving procedure, please see the school nurse in your building.
All right, so I just washed my hands, they're nice and clean. I'm going to put on a pair of clean gloves. At this point, these gloves are clean. I haven't touched anything. I wear my gloves if I was handling food, if I was changing a diaper, if I was dealing with any bodily fluids, if I was treating a child that was bleeding, or I was dealing with yucky things. Once your gloves are dirty, to take them off, I like to use my right hand and take off my left glove first. So I pinch the inside of my left hand and pull the glove off and crumple it into my right. And then I take my left index finger and put it underneath, because this is still considered clean, so clean to clean. And I peel off my right glove and I hold the inside of my right glove. This way I'm never touching anything contaminated. I throw them out and then I wash my hands.
Cleaning, sanitizing, and disinfecting. Equipment that is frequently used or touched by children on a daily basis must be cleaned and then sanitized or disinfected. The product we use to clean is an EPA registered product and has been cleared by the Office of OCFS. Carpets contaminated with blood or other bodily fluids must be spot cleaned as soon as possible. In some cases, this might mean that you make that area inaccessible to children until you can get in touch with the custodial staff or somebody that can clean that area thoroughly. Diapering surfaces must be disinfected after each use. And countertops, tables, and food preparation surfaces must be cleaned and sanitized before and after food preparation and eating. Potty chairs. In general, we don't have the use for potty chairs in our schools. Potty chairs are the freestanding small toilets, not the rings that sometimes go into the larger toilets, but the actual freestanding small toilets that have to be emptied after each use. We don't use these very often. because they do have a specific cleaning, sanitizing, and disinfecting protocol. So we typically don't use these, but if you run into this and you have a student that or a parent that is asking to use a specific potty chair with their child, please reach out to your school coordinator. They'll give you some guidance on how to best handle this. So toys that are mouthed by children must be washed and disinfected each time before they're used by another child. Many of our classrooms, therapy rooms, treating areas will have a basket or a bucket that's designated for toys that have to be cleaned and disinfected at another time, maybe when the students are in music or maybe during a break time. So most of the time we take those items that have been mouthed and we put them in a bucket and then we'll disinfect them all together at the same time. For cleaning procedures at this time, we are not using the green bottle. We used to have 2 different cleaning solutions, but right now we are not using the green bottle. All of our cleaning and disinfecting, we are only using the red bottle. So that's spray solution number 2. The important instructions when using this cleaning is always to apply gloves first. Use paper towels. We don't want to use any cloth or anything. First, you're going to wipe down the surface with a wet cloth and rinse it. Once you spray the solution in the red bottle, it does need to sit for 2 minutes to dry. And then you can either wipe it or it will simply air dry. But the important thing is it does need to sit in order to properly clean and disinfect. So please make sure you're allowing that time. So once again, the spray bleach bottle solutions require 2-minute surface contact time to be effective. So again, that is the red bottle. At each site, the school nurse or another designated employee makes the solutions each day for the red bottle. Each classroom is responsible for filling their bottle halfway for the current day and then disposing of any remaining solution at the end of the day. It's important that you start every day with a new red bottle because the cleaning solution will not be effective if you leave it in the bottle and leave it overnight. You have to have a new one each day, which is why we recommend that you only fill your bottle up halfway because that will generally get you through a full day of cleaning. Confidentiality. Any information about any child in the school is kept strictly confidential. This includes any kind of conversations in hallways, in the break rooms, anywhere, any information that you have about your students and other students must be kept confidential. Each classroom has a red backpack. If your red backpack is worn, seems to have the zippers aren't closing fully anymore, any kind of issues, please see your building coordinator and they will get you a new red backpack. It's important that these are in good shape and that they are used consistently. They hold a lot of important material. So what you should have in your red backpack is a first aid kit, gloves, tissues, and Band-Aids. The red backpack is also going to have the EpiPen for any student in your class that we have a prescription and we have medical orders for. It is absolutely necessary that you take the red backpack with you whenever you leave your classroom to go to the playground, to go to a special, if there's a fire drill, if there's an evacuation drill, anytime you must take that red backpack because it has such critical information in it. EpiPens are prescribed by doctors for students who have a severe, life-threatening allergy to specific foods or other conditions, such as a bee sting. If you have a student that requires an EpiPen, the EpiPen will be kept inside the red backpack in a clear case. The case will also have the doctor's orders on how to administer and assess the student. Every member of a student's educational team must be familiar with both the EpiPen and the doctor's orders. The school nurses at each site will meet with the educational team as well as the therapists and anybody else that sees that student to make sure they understand the doctor's orders and how to administer the EpiPen. When the student goes to therapy, the therapist will be responsible for also taking the EpiPen and indicating that on the name-to-face log. When the student returns, the therapist will indicate that the EpiPen was also returned. If you have any questions on how this is documented on the name-to-face log, we do have a training on name-to-face log, so please take a few minutes to review that. And again, when the whole class leaves the classroom for whatever reason, the red backpack goes, the EpiPen is in the red backpack, it all stays together. It's important that the red backpack remain in a secure location in the classroom that is not accessible to students. When on the playground, the red backpack should remain in a shaded area. Even though it's in a backpack, EpiPens should not be in direct sun or in intense heat. It loses their effectiveness if they are. So just try to make sure that they're in a shaded area, the red backpack, so that everything is okay. In the classroom, again, just make sure it's not accessible to students. But make sure it is accessible for you to grab quickly should you have to leave quickly.
The first step in being prepared for a severe allergic reaction, also called anaphylaxis, is having an EpiPen on hand at all times. But your EpiPen won't do you any good if you don't know how to use it. Take some time now to become familiar with your EpiPen, so should you need it, you'll be ready. For starters, you should be aware of the symptoms that you may experience during a severe allergic reaction. These can include hives, swelling and itching, shortness of breath or chest tightness, cramps, nausea, vomiting or diarrhea, a sharp drop in blood pressure, and if you don't act quickly enough, you could even lose consciousness. Epinephrine by injection is the treatment of choice for anaphylactic reactions because it quickly begins working to constrict blood vessels, relax muscles in the lungs to improve breathing, stimulate the heartbeat, and reverse hives and swelling around the face and lips. Your EpiPen contains a single, pre-measured dose of epinephrine. Using your EpiPen is easy. First, remove it from the plastic tube. Grasp the unit with your dominant hand. Your thumb should be closest to the end with the gray safety release cap, but not over the cap. Then use your other hand to remove the safety release cap. Once the cap is removed, be sure not to touch the black tip at the other end of the EpiPen. This is where the needle comes out. Hold the EpiPen with the black tip towards your outer thigh. Now swing and jab the EpiPen firmly at a 90-degree angle into your thigh. Your EpiPen is spring-loaded and is designed to be used through clothing. Keep the EpiPen firmly against your thigh for approximately 10 seconds. Then remove the EpiPen and massage the injection site for another 10 seconds. Check the small clear window on the side of the EpiPen. If you see the red plunger in the window, it means that the epinephrine has been injected. Also look to see if the needle is coming out of the black tip. Next, take your used EpiPen and without bending the needle, carefully put it back into its plastic carrying tube, needle end first. Then screw the cap on completely. This will automatically lock the EpiPen into the tube for safety. It's important to remember that once you've used your EpiPen, you must seek medical attention. Call 911 immediately or have someone else take you to an emergency room as soon as possible. This is crucial because after 15 to 20 minutes, the effects of epinephrine begin to wear off. In some cases, you may not be able to get to the emergency room quickly and may need a second EpiPen injection. The convenient EpiPen 2-pack is necessary for these situations. Remember to take your used EpiPen with you to the hospital and be sure to give it to your physician for inspection and proper disposal. Before leaving the hospital, be sure to ask for a new EpiPen prescription. It's also a good idea to see an allergist as soon as you can. For more information about EpiPen, visit our website at www.epipen.com. Once there, you'll have an opportunity to sign up for the Center for Anaphylactic Support, your free information resource for severe allergic reactions, where you'll find valuable offers and tips to help you stay prepared. Remember, you can't always predict when you will have a severe allergic reaction, but if you have an EpiPen with you, you will always be prepared. EpiPen is available by prescription only. EpiPen is indicated for emergency treatment of allergic reactions, also known as anaphylaxis, for people with a history of an anaphylactic reaction. EpiPen is designed as emergency supportive therapy only, and not as a replacement or substitute for immediate medical or hospital care. EpiPen should be used with extreme caution in people who have heart disease. Side effects of EpiPen may include fast or irregular heartbeat, nausea, and breathing difficulty. Certain side effects may be increased if EpiPen is used while taking tricyclic antidepressants or MAOIs.